Mr. Bhatia, her husband and father of four, met with a motorcycle accident in early 2018, where he was rendered unconscious as he hit his head on the tarmac and had suffered internal bleeding. He suffered from paralysis on the left side of his body and injuries to his right leg and was unable to eat or breathe properly, nor was he able to remember or focus as well as prior to the accident that changed his life. He also struggled to regain his speech and walking ability post-accident. Mr. Bhatia was in the ICU and had a tracheostomy, a surgically created hole in the windpipe which provides an alternative airway for breathing, and was in a vegetative state where he needed to have a nasogastric tube inserted to allow feedings through the nose. When he was finally able to be discharged from the hospital, he went home in a wheelchair where no rehabilitation exercises were done. Having endured his struggle for 4 months, he finally sought help from Regen Rehab Hospital, and through a series of rehabilitation therapies in an intensive 1-month program, Mr. Bhatia was able to walk with assistance in the 3rd week of his therapy at Regen. Not only that, Mr. Bhatia also regained some of his physical functions and also some quality of life. Alright, welcome back. This is Health Matters with me, Dishen Kumar, and today's topic is traumatic brain injury or TBI, and I'm at the Regen Rehabilitation Hospital here in Petaling Jaya, and today with me is Dr. Kavitha. Thank you, Dr. Kavitha, for joining us today.
Thank you for having me, Dishen.
Okay, so let's start off with, I know everybody has this question, what is traumatic brain injury?
Well, traumatic brain injury is when someone has a blow to the brain from an external force, and this basically causes, it can be temporary or permanent brain damage because of that force that they had, commonly seen after motor vehicle accidents. And because of the injury, this leaves the person with impairments such as weakness, problems with their thinking, behavior, memory, and that really is what traumatic brain injury is.
Now, talking about the blow to the head, how bad or how heavy should be the blow to the head, or how severe?
Yeah, you know, it can vary. For example, an older person who has a fall, which we may think is trivial, but because they already have some shrinkage in their brains, which does affect the blood vessels, they would have a bleed much easier with what we would consider a trivial fall, whereas maybe someone younger may need a harder impact. Actual force, I can't tell you, but
yeah, exactly, I understand. But the interesting part is if usually when you have a fall and there's impact to your brain, if there's bleeding, is that traumatic brain injury, or there are signs or symptoms or things that you can actually test?
If there is trauma, then and which causes bleeding, then that is traumatic brain injury. Sometimes it's not obvious bleeding, what we call like a concussion. You may not really see anything even on a scan, but that is still considered traumatic brain injury. So traumatic brain injury has a spectrum from mild to severe traumatic brain injury.
So if you can't really see it on a scan, then
you would look at symptoms.
Okay.
So they would have things like, even someone who is dazed after a blow to the head would, if you're dazed for a certain period of time, then that is considered mild traumatic brain injury already. If you've got some amount of, you've forgotten parts of the event, those are all symptoms of traumatic brain injury.
But isn't that something like, they say, is it that a concussion?
A concussion is traumatic brain injury. It's in the part of mild traumatic brain injury.
Oh wow, okay. So usually people ask, is it much different from stroke and things like that?
So a stroke is what we call an acquired brain injury. So you're right, it is a form of brain injury, but it's not due to trauma. The symptoms can be the same. Many of the symptoms are the same. Like for example, they may have that typical weakness on one side of the body, problems with talking, problems with swallowing. So a stroke and a traumatic brain injury patient can have similarities like that, but there are usually differences as well. We find that people with traumatic brain injury have more difficulties with things like multitasking, executive functioning, probably more difficulties going back to work. They have more problems with changes in personality and behavior. So there are differences as well.
So if there's, let's say there's a person who enters the hospital with a blow to their head and things like that, what are the signs that actually you look at, or do you immediately say, since there's a blow to the head, there's a very high chance of it being a traumatic brain injury, or is there, let's see how the patient reacts and things like that, and then you treat based on
Yeah, so this is usually done in the acute hospital, not so much a rehab hospital, but when they go in, so the doctors will look at certain parameters, for example, what we call a Glasgow Coma Scale, their ability to obey instructions, whether they're confused or whether they're drowsy. So they usually have cut-offs where they sort of say, okay, this needs a CT scan straight away. Whereas someone who's had a blow to their head, otherwise well, you would probably say, okay, let's watch you in hospital for a while. And then usually they are discharged home. If they're well during that period of time that they're watched in hospital, then they're discharged home with instructions of, if any of these things should happen, then you come back to hospital straight away.
Oh, okay. So not every time that immediately you know that the person actually has traumatic brain. Sometimes it takes some time after some monitoring and things like that.
You would know based on the symptoms. If they came in and said, I had a blow to the head, and or I had an accident and I don't remember what really happened, or someone says, oh, they were quite drowsy initially, but now they're okay, you would know that they've probably had some amount of mild traumatic brain injury, but it's okay to watch and wait. There's no active intervention that needs to be done at that point.
Okay.